Lindsey Graham made a really incoherent point about Medicare in a back and forth during the debate last night. So he's going at it with Bernie Sanders, and let's see how he embarrasses himself.
We spend 12 to 18% to administer the incredibly complex hundreds of plans that we currently have. And with these guys, if they got their way, there would even be more plans, more bureaucracy, more complexity, more money going to the insurance companies. Medicare, the administration of Medicare, costs approximately 2%. So if we are serious about moving to cost-effective universal health care, yeah, we do have to take on the insurance companies. They do not play a role in providing health care. Our money should be going to doctors, to nurses, to hospitals, not to the insurance industry or, in fact, the drug industry, which is charging us by far the highest prices in the world.
Senator Graham, you were shaking your head. Is the bromance over already?
Oh, no. Bernie is the most honest person in the Senate because he believes in government running health care from cradle to grave. All I would say is that Medicare is coming unraveled. By 2038, the trust fund is going to run out of money. And if you're 62 like me and you've worked all your life and you're about to get on Medicare, I think it's a bad idea to have 200 of your closest friends join you, because that's Medicare for nobody.
All right.
I love how that ended, because he made the point as if it was going to have like a big impact, and people in the audience would be like, oh, yes. But it was like incoherent, and everybody's like, and he's waiting for the impact. He's like, I just said the thing that you're supposed to react to, and nobody does it. And he's like, okay. What a loser. Okay, so first things first, it's just not accurate, because he's saying it's going to run out of money. It's going to run out of money. You go back, these are the same arguments that these guys were making from the inception of these programs, and they haven't run out of money. They say the same thing about Social Security. Oh my God, Social Security is running out of money. It's running out of money. Same thing about Medicare. Oh my God, it's running out of money. It's running out of money. What are we going to do? It's running out of money. But it doesn't run out of money. It turns out, oh, it's still solvent for, decades in the future. And when they say run out of money also, by the way, when you crunch the numbers, these programs pay out like 80% or 85% of what they're supposed to pay out when you hit the point decades in the future. So that's a big difference now, isn't it? They go, run out of money. Oh, actually, what I mean by that is you're still going to be able to pay out 85% of what you need to pay out. So wouldn't the logical conclusion be to take these programs, which are overwhelmingly popular, whether it's Social Security or Medicare, 77% approval rating for Medicare, the most popular health care program in the U.S., beats every other one out. Why wouldn't you make, if you needed to, in fact, make minor tweaks to fix the tiny funding gap moving forward? That's all you'd have to do. But no, they want to throw the baby out with the bathwater. And if there is any problems, go, that's it. What are we going to do? We got to get rid of it. That's what we have to do. And then, so notice, he argues it's running out of money, which it's not. But then he goes on to make the point of, well, if you're somebody like me and you're 62, you can't wait to get on Medicare. And you don't want to have 200 of your friends joining, because then it's Medicare for nobody. So it's so good and you can't wait to get on it that you don't want to share that with your friends. Huh? It's like an admission of being wildly selfish. But also the implication is, well, obviously we're not going to be able to afford it if you had 200 more people. Well, yeah, you fucking jackass, because it's not the case that when we do Medicare for all, we keep the same level of funding that we have now. No, what you do is, the current private health insurance system, all the money that you pay in premiums and copays and deductibles and all that nonsense where you get price gouged out the wazoo, so that you don't have to pay anymore, and instead that money comes out of your taxes, and in fact you net save money because you deduct the amount that you would have paid in copays and deductibles and premiums and all that stuff. So it's not, he acts like, well, you keep funding levels the same and then add everybody in the country. No, that's ridiculous. Obviously, you have mechanisms by which you raise the funds through taxes and save money in other ways in order to fund Medicare for all. They just make such bad arguments. It really is amazing. So they have to bring up shit like Medicare for all is Medicare for nobody. Really? Well, why is it that in all the other single-payer countries, everybody's covered and it costs less? I don't get it. So what do you mean? What does that mean? Medicare for all is Medicare for nobody. That shit, you're just saying words that have nothing actually attached to it. It's not true. It's not evidence-based. Look, we have to understand something about the healthcare debate in the United States of America. It is ridiculous. The so-called debate is a bunch of people who know nothing about the way the system works, or they know it, but they're lying to you because they're protecting their for-profit health insurance company donors. But it's those people versus a few people who are telling you the truth and saying, everybody knows Medicare for all is the answer. The science is in on this. So the Overton window, or the spectrum of debate in the U.S. on the issue of healthcare, is so far to the right that it's comical. And that's why people have a skewed perception and really don't understand just how screwed over we are on the issue of healthcare. Most Americans support the right idea, Medicare for all. Overwhelmingly, they do. But for the people who don't support it, they just are totally ignorant to the fact that the rest of the modern world has one version of single payer or another, and they have better outcomes and it costs less. And another thing that Lindsey Graham lied about there was how Bernie wants the government to control it cradle to grave. Well, no, because when Bernie gives the details of his ideal single-payer system, it's more of a French-style single-payer system or a Canadian-style single-payer system, not a UK-style single-payer system. So in the UK, it is public money going to public institutions and public doctors, public surgeons. So everybody is a public employee when it comes to healthcare. In France and in Canada, it is public dollars funding private institutions. So the doctors are private, the actual institutions themselves are private, but it's publicly funded. So not for profit, but private institutions, public funding going to private institutions. That's what Canada has. That's what France has. UK is public everything. So there's different varieties and flavors of single payer. And Lindsey Graham is lying about the one Bernie supports because he's trying to do the boogeyman like, ooh, you want the government to control everything. And by the way, even if Bernie did favor a UK-style single payer system, that's still way better than what we have now in the US. I tend to agree with Bernie that I like the Canadian and the French system a little more. But if we had the UK system, it's not like, that's horrendous. No, that's one of the top-ranked systems in the world. So even with his attempt at the scare-mongering talking point, it's just ridiculous. Even with trying to smear Bernie, Bernie could effectively say, yeah, that's what I want and it's better than what we have, and he'd be right. So this debate is a non-debate, and that's why it's so maddening.